Can you introduce yourself?
My name is Vivian Acosta Cedeño. I'm a licensed clinical therapist. I am Latina. I'm bilingual. I am a first generation graduate from NYU. I focus on women's health, specifically in fertility and life transitions.
What are CBT and ACT?
CBT is cognitive behavioral therapy, and ACT, we call it ACT, is acceptance and commitment therapy. And CBT and ACT are both evidence based approaches. They've been around for years. ACT is a little bit newer, it came out in the 1980s. And although they both tell us to manage our emotions, our thoughts, and our feelings, they have different approaches. So CBT tells us that it's okay to challenge our thoughts and create new ones that are helpful, especially when they're a bit irrational. ACT tells us that it's okay to create space for these thoughts and feelings and that we don't have to judge them, we don't have to label them. We can just allow them to be and see those thoughts from a distance in order for us to create a meaningful life and really do things that are valuable for us.
And why might these approaches be helpful for people impacted by cancers?
Specifically, ACT is it's very meaningful for people impacted by cancer because there is a rational thought behind all the feelings that cancer evoked. Fear, some guilt, some grief, they all have an evidence, right? And in CBT, a lot of times we're looking for the evidence to create a helpful thought, to challenge that thought. With ACT, it's not about challenging the thoughts. So I particularly like ACT, and there is a lot of research that tells us ACT is more efficient for cancer patients because we're looking for what is valuable in your life, what is important for you. And even though these thoughts and feelings are happening in your life, how can we still move forward with the discomfort and create meaningful moments for you?
Can we talk a little bit about discomfort?
Yes, discomfort. So, the other wonderful thing about ACT is that it tells us to sit with discomfort. That when we have these fears, when we have these thoughts that aren't so great, they feel horrible, they feel very not so pleasant, we will try to push them away. I don't want to feel that. Because I don't want to feel that, I'm going to engage in, some people will engage in unpleasant things or unhealthy things. So, avoidance is a big piece. ACT does tell us to challenge the avoidance, to actually sit with that discomfort.
Do you have any actionable tips for a breastie who's looking to get started in addressing their mental health?
I have a long list that I would like to share on tips to find mental health assistance, and because these things are very difficult to talk about. Sometimes part of the avoidance is not wanting to talk about these things. So I think the first step is understanding that it's okay to talk about these hard things, exploring vulnerability. And vulnerability is a huge topic that a lot of times we don't want to explore because of social conditioning, because of core beliefs, because of our foundational thoughts that we have to be strong, but we really don't. There's a lot of strength in vulnerability, in exploring the things that make us uncomfortable, in exploring the things that are really hard to share. So the first tip that I think is important is using our trusted directories. So we know about Psychology Today, Inclusive Therapist, cancercare.org, Alma, your oncology social worker at the hospital or the cancer centers. They usually have referrals, a referral list that they can send you to. Your insurance card, that's a great place to look. Behind the insurance card, there's a phone number, and you can ask about behavioral health. and they'll usually tell you what's in network and then what's out of network. And always ask about out of network benefits. There may be a therapist that you may like to explore, but they're not in network. There are therapists that will allow you to pay up front and then give you a super bill so that you can request reimbursement if you have out of network benefits.
When it comes to finding a mental health professional to work with, would someone who is newly diagnosed want to look for something different from someone who's in survivorship, or might they look for very similar characteristics?
I think for someone who is recently diagnosed with cancer or someone who is a survivor of cancer, they're both navigating new things. It's a new adjustment for both of them. It's a new journey for both of them. So I would say it's the same thing. You need the support to go through this new adjustment, to go through this new life transition. Because there will be a grieving process that occurs when you find out about this new diagnosis. And then there's another grieving process that happens when you find out that you have survived cancer. So they both require someone that can support you through the transition.
What is that grieving process like for survivors?
That grieving process is really hard because it's really thinking about the life that you losing the life that you envisioned, thinking about, I have some clients that will say, I live quarterly, and so I'm not sure what's going to happen next, and there's a lot of uncertainty. So the grieving process can be very sad. There's a cycle that happens, and someone that is grieving the loss of the life that they envisioned goes through the same stages as someone who is grieving the loss of a loved one. And there's 5 stages to grief. We have denial, bargaining, anger, depression, and acceptance. And those stages do not happen in any order. It just happens as it comes. There is absolutely no order, and sometimes you can go through all 5 and then start all over again. So to have someone, especially a licensed therapist, to go through these processes with you, I think is very essential.
Are there any challenges other than grief that might arise for someone navigating survivorship?
The other challenges that may come up other than grief may be body changes. A new identity may arise. Fear of recurrence. There may be financial worries. So yes, certainly more challenges may arise.
What is one way that you think breasties can and should feel empowered to advocate for themselves when it comes to finding mental health support?
Your voice shapes your care. And I think it's so important. Self-advocacy is so important. Speaking up about what you need. You know your body best. So speaking to your providers about what you need, how you feel, that can really be helpful. And it's okay to say, hey, I need some time, or to ask clarifying questions.
What is one misconception about your area of expertise that you would like to correct or clarify?
I think clients think that they have to come prepared to therapy, and there is no preparing. This is the only appointment that you can come as you are, and you don't have to prepare for. It is my job to guide you, to support you, and I've had clients that don't want to say anything because I don't know what I need, I don't know what I want, I don't know what's happening, I'm trying to understand all these things, and that's okay too. It's my job to guide you and allow all these feelings to exist in you.
So does a breastie who's new to therapy need to know what their goals are the first time they sit down across your meal?
No, it's okay for a breastie to tell me, I don't know what my goals are. I just know that I need support right now.
What does breasties having the power mean to you?
Having the power means reclaiming ownership to your story. You don't need permission to feel what you feel. Your worth is not tied to your diagnosis. So I think it's also thinking about reclaiming what you can control. So focusing on your nutrition, focusing on movement. Movement is medicine. Even if it's a little walk, even if it's stretching, spending time with loved ones if that's important to you. So, what are the things that I have the power to do? What are the things that are in my control?
What is one low lift option you would give to breasties if they want to get started, but they like feel so bogged down by the pressure of just getting through the day to day?
I've said this to grieving patients. You don't have to take it day by day. Sometimes a whole day is too long. Taking it hour by hour, even minute by minute. So, this minute or these next 30 minutes, I'm going to focus on enjoying this meal that's in front of me. And that's another wonderful thing that I love about ACT is that it allows us to be in the present moment. So, at this moment, I want to eat this meal and I want to enjoy it. What colors do I see? What do I smell? What do I hear around me? And that really grounds you and it allows you to live with more purpose, with more meaning, to actually feel some joy. I think a lot of times because we're thinking so much about the cancer, it robs us from some of the joy that we're allowed to feel.
Thank you so much. This was great.